Well, thank you, Dr. Sala. After so many so interesting presentations, I think I have nothing more to say. In a few minutes, one or two, I will tell you which is our position on where and how to respond when fertility preservation is required. And you know that we began our activity in 2001. And at that time, we had just only ovarian cortex preservation. And when we went to organize the first World Congress on the fertility preservation in 2002 in Taormina, we spoke, we dealt exclusively with fertility preservation by ovarian cortex slow freezing, and that's exactly what we did. And at that time, Eleonora Porco was there. She had started with good results with oocyte cryopreservation, but she didn't speak on this. The following years, we have adopted both the techniques, and we have presented the results in Tel Aviv in 2015. And the main reason for our initial choice was that for a long time we have been working in a university hospital where a large oncohematology department was present, and the fertility preservation required were coming really every time from very young women with Hodgkin disease, leukemia, and something like this. In some cases, these women were in physiological amenorrhea. Donc our choice was practically necessitated. We've just seen in the clear and exhaustive presentation of Dr. Diaz-Garcia a comparative evaluation of the two approaches. Well, the last 10 years, oocyte harvesting and cryopreservation by vitrification generally has been widely adopted in the treatment of patients with breast cancer due to the introduction of new protocols, safer protocols of iron stimulation, to development of more efficient cryopreservation methods, vitrification. This approach is today still not free of controversies, uncertainties. Not least the observation that the cancer patient gametes may be of poor quality oocytes than those of healthy women, as shown by the comparison with a group of women in which oocyte pickup has been adopted for social freezing. It seems that oocytes pickup, freezing, and reimplantation may be responsible for altered folliculogenesis, mainly in relationship between granulosa cells and oocytes, and finally it's difficult when a pregnancy is achieved to exclude the possibility that it may be attributed to the residual activity of the native ovary. On the other side, notwithstanding the low percentage of reimplanted ovarian cortex tissue, the actual results are so encouraging that there is an increasing support to the idea of removing the term experimental, like they did in Israel recently, from the wording surrounding this procedure. And this is, in 2 minutes, I told you what we think about this situation, this double possibility. And now Dr. Scaravelli will present you the results in Italy. And please come.